that was a natural part for me. Number two, because my late father was also obs and gynae. Sorry, it was also an obs and gynae. Apologies for that. And probably that also, had some impact in my decision making, choosing obs and gynae as a specialty. So I would say it's kind of hereditary, but it's by choice. Now, your next question is that how do I balance business and everything? First of all, whether we like it or not, we are all businessmen. Before I continue, do you want me to turn my phone landscape, or you're happy with the portrait projection of my device?
Okay, let's see landscape.
Let me try that first of all. Okay. No, it's not better. I'll leave it as it is. Okay, good. So, as I said again, whether we like it or not, we are all in the business of salesmanship. Whether you like it or not, whatever you're doing, whether you're employed, self-employed, whatever you do, you are selling for somebody, or you're selling yourself, you are carrying your brand. So we are all businessmen, indirectly or directly. So, and personally, I've always desired, maybe from my experiences with my dad, that for you to be comfortable in your life, you have to be self-employed. Now, whether and if you're self-employed, you're working for someone anyway, whether for yourself or your client, you're working for somebody. So, and there's nothing wrong in working for people, as far as you know where you're going. I tell people all the time, even if you're working for somebody, you should be developing yourself. At some point, you have to. If you don't, you decay. They'll get someone else to replace you. And there's nothing called you are not replaceable. It's a lie. It's the biggest lie of employing people that be irreplaceable. Who told you you're irreplaceable? You are not replaceable. Anybody's replaceable, whether you're good or bad. So I decided that I have to do business so I can get to where I want to do. I'm still working for hospital. I'm still self-employed, but I can never stop doing business, and I can never retire. I can never retire. Retirement is just, for me, is like you change your pattern of work. You still work until you die. If you stop working, you're going to fizzle away. So the best way to do that and to get the best reward is to be self-employed, and not only self-employed, to be a business owner. Self-employed is also grinding on the mill. You have to own your business. You have to also invest in other people too. That is why I'm always out there looking for people, to work with and to collaborate with. Man, woman, young or old, you have to. So self-employment is the first step out. Next thing is to be a business owner. Next thing is to, and I'm a stammerer and I'm camera shy until 5 years ago. Most people won't believe I never knew how to talk, and I've never spoken in public until about five years ago when I started as a gynecologist, and I was forced naturally to start speaking. I've always looked for a way to do business where I'll be inconspicuous. And people know that I stammer, but it's a slow process. I've been overcoming that. Maybe at some point you will discover it as I talk today. And there are a lot of things I'm trying to overcome personally. So we are all going through that. So business to me was just a natural thing. And because I love numbers, I had to gravitate into doing stocks and Forex, which I've been doing for the last 12 years. And at some point I moved to America from UK, and I did masters in public health. I couldn't get into the US health system there, so I came back to the UK again to start all over again. And so I did my masters in public health there, and all the time I'm always glued to the market, checking things. Sometimes I'm detached, but I just want to know what's going on in the market, and whenever I see opportunities, I trade. And to God be the glory. Over the last 12 years now, since 2004, I've been trading. There's never been a year of loss. Cumulatively, it's been gainful. So I give God the glory for that. And people that I've been working with, they've that are managing their funds, they've been doing well. And people say, how do I cope? I'm like, it's just you. It's like, how do you eat? It's just you. It's just you. How do you love your wife? How do you love your children? It's just you. It's just part of you. It's part of you. So it's difficult for me to say, how do I cope? You just find a way to do anything you love. That's it, to be honest.
So once you have a passion for it, you just find a way to strike that balance.
You find a way, yeah. You find a way. You find a way. So that's it.
Okay, thank you, brother. Thank you, brother. So today we're talking about infertility. Both men and women. So what is infertility?
Infertility can be, basically, is having difficulty in getting pregnant, conceiving. But when people hear infertility, the first thing they think of is that is the woman's problem, because you never see a church or any program saying that they want to pray for men that are not pregnant. They say they want to pray for women that are not pregnant. It's as if the men, they are holier than thou in infertility. But in the medical world, we know that infertility can be from the man, woman, or from both. In fact, 30 to 40% of infertility cases is the man that has a problem. And I've been seeing results for the last 6 years we've been doing Ask Gynaecologists, and men have issues with infertility too. But the fact is that the society does believe that the women, and sometimes too, the women take the burden on themselves. So infertility is basically inability to get pregnant after regular, consistent vaginal unprotected intercourse for at least 2 years. If you're less than 35, and if you're more than 35, 1 year. If you're not getting pregnant, you have to get investigated. That's infertility. It can be primary infertility, it can be secondary. Primary infertility is that you're not able to get pregnant, you've never been pregnant before. Secondary infertility is you're not able to get pregnant and you've been pregnant before in the past.
Okay, thank you very much for that. But I feel like that classification will only apply for women.
Yes, that classification, is for women. Yeah.
Oh, okay, thank you. So my next question would be: so what are the causes of infertility? What?
Thank you.
Is it acquired or other?
Infertility itself, the causes, okay. I'll divide it into 3 broad causes, okay, and I'll start going on under them. The first thing is that for you to get pregnant, you must have a regular intercourse. If you're looking for a job, the only thing you should do is to apply for a job. A lot of people I talk to trying to get pregnant, they don't even have sex. They have sex maybe once in 2 months, once in 3 months, in 6 months. And you say, yeah, we are trying, but what are you trying about? You're not having sex once in 3, once in 4 months, and you're trying. You're not trying. To get pregnant is not easy. It's not a joke. So first of all, is regular intercourse. That's the number 1 cause of infertility. People don't have regular intercourse. People associate sex with sin. There's nothing wrong with sex. Anything you do out of when there's no discipline becomes a sin in some religious quarters. But as a medical doctor, let's remove church and mosque. There's nothing sinful in sex. As a doctor, people need to have sex for me to be in job as a gynecologist. So I want people to have sex. When people don't have sex, they don't get pregnant. And about having sex for pregnancy, it's not only having sex during ovulation, it's having sex regularly. We'll get to that later. The next 3 items are important. First of all, sperm must be good. Sperm must be good. Number 2, the tubes must not be blocked. Number 3, there must be ovulation. If all these 3 things are not there, it can't work. If you have a good car, a Porsche, and there's no petrol in the tank, it's not going to move. If there's petrol in the tank and there's no good spark plug, it's not going to start. So sperm is like petrol. Spark plug is like you're ovulating. Okay? So those are the 3 causes. Regular sex, take it aside. Good sperm, good tubes to get the egg to move from the ovary to the womb. And lastly, the person is ovulating. So if someone can't get pregnant, we do investigations to check these 3 areas that I've mentioned. I'll first of all ask them, are you having regular sex? Because sometimes when you now drill down, you realize that the husband is in America, or the husband is in Italy, and the wife is in Nigeria. They're not having sex. They're only having sex once in Christmas. And then that could be the problem. They are okay, but they're not having sex. So by asking that question, you realize that there's something wrong. Or maybe the husband is in Abuja, wife is in Ondo. By asking them a question, are you having regular sex? You discover that actually the problem with infertility they're having is because they are not having regular sex. They want to also have clarified that area. The next thing I move on is check that, okay, have you had children before? Secondary or primary infertility? Because if they've had children before, maybe something changed. So what changed? After that child, was it C-section? Was it complicated delivery? Did you have a D&C afterwards? Was there any infection afterward that may have damaged the tubes? Did the man have an infection? Did you have fibroid surgery in between? What may have changed? Because if someone had a child before, suddenly they can't get pregnant again, something has changed. Or probably the woman is not ovulating anymore. So after that, I move to the next question as well. I want to know, has the man had children before? Now, if not, Has he got male siblings? Do they have children? If it's yes, fine. If it's no, maybe there's an hereditary connotation from the man's side. Because I've seen a man before, in fact, not the man, the wife's aunt came to me. Oh, the man said he has had a baby before. Blah, blah, blah. What do you mean? He said, oh, the man had a girlfriend in high school. The girl had a baby for him. I'm like, are you sure? And the reason I was asking that question from them was because they told me that this guy, they did the DNA analysis, the man's chromosomes, and they discovered that he has XXY chromosome. What that means is that what we call Klinefelter syndrome. And in that syndrome, the man has no sperm. So I told them that if this guy has Klinefelter syndrome, KLINEFELTER for our audience, that man is not producing sperm. I said, go and find out. Then later on in that conversation, they now told me that actually the man was going to find to do some digging out, and he was told by his ex-girlfriend then that baby was not his. She was just trying to force that baby on him. I said, look, this man cannot get pregnant. There are different variants of Klinefelter syndrome, but in most of the variants, the man does not produce sperm. This man needs sperm donor. They couldn't come to grasp with it. They think it's devil. They say, oh, God forbid. You know, that's our Nigerian people say, hey, God forbid. It's okay. I'm a doctor. God will forbid. But I can't tell you what I know. I'm not a pastor yet. So that was the last I heard from them. So we want to know, as a man, has he got siblings? I mean, male siblings. Do they have children before? True, yes or no? I tick that box. And I'll move to those tests I've mentioned. I want to know if the tubes are blocked. The first thing I want to do is that I do HSG, hysterosalpingogram. This test is an X-ray test. Yeah, HSG. It's very popular in Nigeria. A lot of women do it. And I tell people, before you get pregnant, I did a special video on YouTube. Watch that video. Before you get pregnant, you must watch it. You don't want to get into pregnancy and then start to discover things and you say it's devil. It's not devil. It's because you didn't do what you're supposed to do. There's some tick boxes. Apart from love, some things are very important. Yes, if you say, okay, fine, all these things you know, and you say you're okay with them, that's okay. But at least you know. So you have to do those things. Okay, when you want to get pregnant, you want to marry, as a woman, you must do your genotype. You must know your husband's or fiancé's genotype. If you don't know it, you're joking. Okay, in Africa we go ASSS, and when you see SS children, you will cry for them as a doctor. You don't want to bring those children into the world to come and suffer. So as a woman, if you want to get pregnant, you must do your genotype. You must know your husband's or fiancé's genotype. So that aside, let's go back to infertility. So I want to do HSG. HSG is hysterosalpingogram. There are many tests we do to check whether the tubes are open or closed. We call them fallopian tube patency test or tubal patency, to check if there's any blockage in the tubes. HSG is the cheapest and most available test. It's an X-ray test. It's uncomfortable for some women. During HSG, they can be in pain. Basically, we push in a contrast from the vagina into the womb cavity, and the contrast is like a dye. It flows into the womb cavity and goes into the tube on one side and on the other side, and it spills into the tube through the tummy on this side and on the other side, and we can see it on X-ray. If there's what we call bilateral spillage on both sides, it means the tubes are not blocked. But if we can't seal spillage, it means that there's a possibility of blockage on either side. Now, even if one tube is blocked and you're ovulating, you can get pregnant. So you just need one tube to be functional to get pregnant. So that test is highly important. There are other tests we do to check tubal patency. They are slightly invasive. The number two is laparoscopy and dye test. We put a woman to sleep. We put a camera through their belly button, through a tiny incision or cut on their belly button camera, and then we flush in a blue dye from the vagina into the womb cavity, and that blue dye will spill into their tubes, and we see it naturally, physically spilling into their tubes, into their tummy, like that on both sides. The body absorbs those dye anyway, so don't panic. The body will absorb it, so we see it. That's another test for doing tubal patency. The other one is what we call hysterosonogram, where we scan and we also push fluid into the tubes, and we see the fluid going through the tubes into the tummy on scan. It's very detailed, but all of them require skills. The one that is very easily done is the HSG available. Okay, so that HSG is very important to see if there's any blockage in the tubes. Before you do HSG, obviously there are a lot of things you should do. For example, check whether there's any infection in your vagina before we do the HSG, because we don't want to push an infection in your vagina into your tummy that will not cause more problems. Why do we do HSG? I said again, to check if the tubes are blocked or not. What will cause tubes to be blocked? Number one, infection, chlamydia, gonorrhea. Whether it was treated or not treated, or it was undertreated, it can cause damage. And the more women are exposed to infection, chlamydia, gonorrhea, it causes cumulative damage to the tubes. You have 1 chlamydia, 2 chlamydia, 3 chlamydia. It will cause damage. After a while, the tubes will be blocked. It will form scar tissue in the tube, like cobwebs, like nets in the tubes, and that will prevent passage of eggs. Am I making sense so far? Is my audio good?
Yes, you are.
Okay. So should I continue?
Yes.
Okay. So that's number 1 test to check whether the tubes are blocked. Important. Number 2 is to check the sperm. Semen analysis. A lot of men are opposed to semen analysis. They don't want to do it. It's because we are afraid. We don't know the truth. And it's the easiest of all tests to be done. You just masturbate and you're even having fun while you're producing the sperm. Imagine what women go through: needle, scan, all those things women go through, HSG, painful things. The man just need to produce 2 or 3 tiny drops of semen to test. Some men, they'll be stingy. It's as if you want to collect $1 billion from them. They won't. So I always wonder, marvel, why men are difficult trying or not to do. And I think maybe too, women are not carrying them along, or probably too, some men don't know, because what you don't know, you'll be afraid of. And some of them are afraid to say, maybe they will say they don't have good sperm. They're afraid. And once a man is not producing good sperm, a man might lose his self-esteem. A man might lose his ego. A man might lose his value. It is possible. So maybe that's why some men are afraid. So sperm test is important. We need to know. And when we do sperm test, we want to know a lot of things. Are the sperm moving fast? Are they normal? Some semen, they have 2, some spermatozoa, they have 2 heads. They are confused. They don't, one is swimming forward and that one's swimming backwards. They are confused. We want to know, are they normal? Are they moving fast? Are they moving slow? Some will move and they will die on the way and they can't know where they are going. Some will get lost and they will swim backwards. We want to know, are they moving forward progression? And did they have good motility? Are they normal? Are they getting tired? All these things we see on sperm count test. And also the most important thing is the number, sperm count, because nature produces many things. Nature knows that most things will not survive. So nature does what we call survival of the fittest. So nature will make you produce at least 40 to 40 million sperm or more, knowing that most will die. Some will get lost and they won't ask for road. Some will get lost, they won't have GPS, they will not know where they are going. Some will even swim, they will stop, they just sit down and they'll be tired. But nature produces so much so that you have at least that one to hit the target. You wonder, okay, if nature only needs one to get pregnant, why do we need to produce so much, 120 million sperm? That is nature. Nature does things plenty. Okay, there's never lack. So because nature knows that some will die, some won't swim, some will get lost, some will pour out, but the fact is that you have to produce minimum of 40 million to achieve pregnancy. That is what the WHO wants. So we check out for all these indices during the semen test. And the last thing we do is to do what we call test to see if the woman is ovulating. That is some blood tests and ultrasound scan. So during the blood test, we want to do your hormones. Okay, there are many hormones in the body, but we focus on about 6 of them, which are very, very important for infertility or for getting pregnant. And these tests are to know whether you're ovulating. Remember, I said 4 things or 3 things we need to do for infertility to know is: are you having regular sex? Are the tubes blocked? The semen, and the last thing is ovulation. Are you ovulating? So to know whether you're ovulating, what we need to do is to do this hormone test, and we do them at different points in time during your cycle. The first one is your LH and FSH. LH is luteinizing hormone, and FSH is follicular stimulating hormone. This hormone, they are produced in the brain in a particular organ called the pituitary gland. In fact, that pituitary gland produces all the hormones that your body needs to function properly. Okay, your body needs to send message through Wi-Fi from brain to a different part of the body, and hormones are the messenger. They are the Bluetooth of the human body, or whatever you call them, or infrared. So this hormone is produced from your brain, and it tells your ovary to release egg. That is to say, the FSH and FS and LH. One hormone will tell the ovary to release egg. One hormone will tell the ovaries to mature the eggs to get them released out. They work together, and they also antagonize each other. They work together and they antagonize each other, but they work together in most cases. So this hormone sends messages to your ovaries to produce eggs, and your ovaries also produces 2 other hormones called progesterone and estrogen. So we must check your LH hormone and FSH hormone, okay, and your estrogen, okay, done around between day 2 to 5 of your cycle. We check your progesterone on day 21 of your cycle. Some will say, but doctor, my cycle is not regular. How do I know the day 21? Relax, I'll tell you. Don't worry. So FSH, LH, estrogen between day 2 to 5 of your cycle. How do you know day 2? The first day you see bleeding on your period is day 1. Start counting from there. So that aside. So LH, FSH, estrogen. Progesterone, day 21. You count 21 days from that day 1. You do your progesterone. Then also, we need to know your prolactin. Prolactins are another hormone produced in the brain that tells the body to produce breast milk, or to tell the breast to get matured to produce milk. And it does that after a baby is born, or during pregnancy, before a baby is born, so that the baby can feed. So what your body is saying, that you're producing breast milk, you're feeding a baby, you're nurturing a baby, it's not time to get pregnant again. So if you have high level of prolactin, your body is saying that you're producing milk to feed a baby. First of all, focus on that baby, nurture that baby. It's not time to get pregnant. So if I see a woman that is not nurturing a baby, that her prolactin is very high, that is disharmony in the body. It says you're having a baby, but you don't have a baby. It's confusion. Any confusion becomes disease. That is why if somebody says, I love you, and the person is frowning, that person doesn't love you now. You don't say you love you and you're frowning. You don't say good morning and you're angry. That means it's not good. So, it's body language. So if your body is producing high level of prolactin, but you don't have a baby, or you're not feeding a baby, it doesn't make sense. Or you're not pregnant, it doesn't make sense. That means that your body is saying that don't ovulate. High prolactin means body, don't ovulate, don't get pregnant, because you are busy nurturing a baby, or you're already carrying a baby. If you're pregnant, you have high prolactin. If you're having a baby, you're breastfeeding a baby, you have high prolactin. But if you don't have any of those and you have high prolactin, there's confusion. So that means that you're not ovulating. High prolactin means that you're not ovulating. If you're not ovulating naturally, you can't get pregnant naturally. For you to get pregnant, you must ovulate. You don't ovulate, we have to make you ovulate by inducing ovulation by force. Okay, so if your prolactin is high, you're not ovulating, we need to bring the prolactin hormone down. So prolactin hormone is one of the hormones we check to know whether you're ovulating. The other hormones we check, they are testosterone and AMH. AMH is anti-Mullerian hormone. AMH is a test we do to check for the egg reserve. Now, the ovary, has two problems. Oh no, not one, two issues. There's one about quantity and there's one about quality. Quantitative and qualitative. People mix it up together. Okay? Now, if a woman is born, from the day a woman is conceived and born, the amount of eggs you have is in your body regular. It does not increase in quantity. It will only depreciate as you get older with time. I've seen many people come to me, doctor, and they told me that my egg count is low. How can I boost my egg count? It's not possible. If anybody is selling you any snake oil to boost your egg count, that person is just using your money to smoke Igbo. As a doctor, I know that you cannot increase egg count. Once a woman is born, the amount of eggs you carry from that day when you're born, so it's about in millions before you're born. Once you're born, it drops to about 500,000. It starts to depreciate. Once you get to 35, it starts to fall quickly. That is why we say women have biological clock. It is true. It's a fact. People knew it before we were born. So, and God hasn't created a new edition of human beings. We are all the same. Whether you are white, brown, yellow, pink, or you're red, it's black. It's all the same. There's no new edition yet. Okay. So if we know that the amount of eggs a woman has depreciates in quantity and in quality. Okay. Some people, because of their lifestyle, they're smoking, they're drinking, they're doing all these stupid things, their egg quality will depreciate. Quality depreciates faster than expected. And some people too, maybe they have other medical problems. Maybe they are having chemotherapy, radiotherapy as well. This will also affect the quantity and quality of eggs as well, which is unfortunate. Okay, but removing that aside, people need to live healthy lifestyles to give their eggs the best chance. But apart from that, the quantity you can change. It's just there. It's like age. You get older. I can't become 6-year-old today. It's not a case of Benjamin Button, where I'm getting younger as I get older. No, once you're born, you're getting older, your eggs will depreciate in quantity and in quality. You can only work on the quantity, on the quality. You can't affect the quantity. So, how do we know the quantity? By doing anti-Mullerian hormone test, AMH. and that can be done at any time. Yes, so we do AMH. It gives us an idea of the quantity, but not the quality. We can only know the quality at the laboratory after we've aspirated the egg. We put them under a microscope to see how they are dividing. Then we know that this egg is good enough for IVF during IVF. But without IVF, we can't know what it is with the egg quality. So that is summary. Now, another thing that is essential is we don't do this often, except a woman is having recurrent miscarriage. Maybe they got pregnant, miscarried at 10 weeks. They got pregnant, miscarried at 12 weeks. Okay, we start to wonder, is there something wrong with the house? Maybe the house is not comfortable. And what is this house? The womb. So you get pregnant, so it's not infertility now, but the person is having recurrent miscarriage. We need to know what is wrong. Because that is not infertility, but that's also a problem. So that is when we start to think of doing ultrasound scan. But it's always important anyway. While doing tests for infertility, ultrasound scan must be done. Because I've seen people, they thought they were pregnant and they thought they have womb. They didn't have womb. So they're trying to get pregnant, and maybe in the past they had some complication and the doctor removed their womb and they were not carried along. It happens in Nigeria. It happens in some part of the world. I won't mention countries. So because I don't know who is watching this video, okay? So first of all, we scan you to know whether have you got ovaries, have you got a womb? So it's important. And also, is the womb normally shaped? People have different types of womb. Their womb is abnormal. This is a normal womb, okay? It's like this. The central body, the tubes and ovary on one side, the tube and ovary on the other side, okay? Some people have abnormal womb. One half is gone, or there's no ovary at all. So we need to scan to know, is everything okay? Some people, they have a normal womb, but inside the womb there's a contour, maybe from fibroid, from polyps, or the womb has 2 compartments there, making them miscarry. So we have to scan the womb, or we can even do hysteroscopy to look into the womb cavity to see if there's any issue with the anatomy itself inside in the womb. But those ones we do for recurring miscarriages. Am I making sense yet? So before we continue, in a nutshell, infertility, we do investigations for the man, sperm analysis, very easy. Test for ovulation, all this hormonal test with ultrasound scan, HSG to see if the tubes are open, or we can do laparoscopy and dye test. And remember I said that if your period is irregular, you do day 21, what should you do? Irregular periods come in two forms for people, not for doctors now, for our viewers. It's either your periods, they are so irregular that you don't even know when they will start. One last month, one in 4 months' time, one in 6 months' time. If you're having a irregular period, it's difficult to know your day 21. Or if you're having no period at all, entirely stopped, what do? We can give some medications to you to make you have withdrawal bleed, and then we start counting day 21. Or you just know whenever you bleed, start counting 21 days and you do your test. Now, it's paramount that I use opportunity to tell people that our ladies must do cervical smear test. If you're less than 60 years old, do it every 3 years. Cervical smear is we examine you on your vagina, and there is this opening of your womb called the cervix. If you put your finger, as a woman listening to me now, put your finger as far as you can. Clean finger, or not finger with pepper in your hand, though. Clean finger. As far as you can put it into your vagina, you'll feel a substance as soft as your nose at the top or at the top of vagina. You feel inside there, you feel it's very soft. That's your cervix. We take cells there. It's not painful at all, very easy. Cells there, like a sample there, every 3 years to check for any abnormality that could suggest that person is having signs of early cancer. Cervical cancer is highly preventable, and it can be screened for and tracked, known and treated even before it starts. So cervical smear is also called pap smear in some part of the world, maybe in America or in some part of Europe. We call it a pap smear, Papa Nicolau smear, or cervical smear. It's all the same thing. We call it cervical smear in UK. It's all the same thing. Do it every 3 years. And if you're on maybe dialysis, renal transplant, you got maybe history of HIV, you should do it every 6 months. And yeah, every 6 months, yeah, because that can cause irregular bleeding. Now, what can cause blockage in the tubes? Number one, like I said again, infection, chlamydia, gonorrhea, all these funny infections and so on and so forth. If you see one infection, the other one is there. They come with their brother and cousin. They don't come alone. Infection, they come with their family, grandfather, and ancestors. When you see one, look for the other one. That's number one. If you're having offensive discharge or pain on both sides of your tummy, okay, or pain during your period or bleeding during sex, check for vaginal infection. Number two, what can cause blockage in tubes is endometriosis. Endometriosis is basically, if I bring this womb closer to my screen, you see some black spots behind this womb here. See those black spots there? That is endometriosis. And what are they? Okay, so I'll bring it closer to my viewers here. You can see all those black spots behind the womb there. Those black spots here and there. Okay. Now you can bring the camera back again to our viewers. That is endometriosis. That is endometriosis. How did they get there? We don't know. But what are they? They are the cells that line the womb cavity. You see, this womb cavity is cut open. There are three entire layers. The one inside that the one inside that's pink as my lips, the red one that is the muscle bulk of the womb, and that brown one outside here. This is the mucosal layer, the myometrial layer, and this is the subserosal layer. You can have fibroids anywhere, but these cells inside that are pink as my lips is the one that bleeds every month during your cycle. For some reason, some of them will find their way outside the womb and go and implant on this outside here. You see them there. And these ones here outside, they are just like their own friends or cousins inside the womb. They can't bleed out. Some of them can be so bad, they can go and get stuck to your ovary or to your tubes, and they make the tubes damaged, and the tubes cannot open freely to catch the eggs. Endometriosis can affect the tubes, can affect the ovaries, can affect an implant on the bowels, on the intestine, or even at the back of the womb. But they will stretch at every point you're having period, and they will shrink after your period is gone. That is if you are having pain, very, very common and getting worse as your period progresses. Around your period time, you're having pain around your period time. The pain is so bad, it could be from endometriosis, and the pain will get worse with each subsequent periods. This pain gets worse. That is endometriosis, and that can cause damage. That can cause blockage in your tubes. If you have endometriosis, the treatment will be to use surgery to remove them, or we give hormonal medication sometimes. But those hormones to treat endometriosis will make you not to get pregnant. Number three, what can cause tubal blockage? Fibroids. Very rare, but possible. Fibroid, I said the womb has three layers. The one inside, which is pink, the red one, and the brown one. Fibroids can be anywhere. It's like the wall of a house. You have the wall. There's a part of the wall that is facing your living room inside. There's a block in between, and there's part of the wall that you paint outside on the road. That wall has three sides. So you can have fibroids at any part of the wall, inside, in the middle, or outside. Fibroids are when part of the muscle bulk of the womb, they just get thickened. Like that thing. You see that thing, that white thing there? They get thickened. They can be thickened and so thick inside the womb wall, outside the womb, or in the womb cavity. If you have fibroids close to your tubes, they can cause tubal blockage. If you have fibroids in your womb cavity, they can cause miscarriage. If you have fibroids in the wall of your womb, they can cause pain during periods. If they are outside the womb, they can cause pain as well if they twist on themselves. So, but the treatment for fibroid is obviously surgery or medications to shrink the fibroids. But any drug we use to shrink fibroid, they will make you not to ovulate. That's the honest truth. And once we stop the medications, the fibroids can grow back. I've seen people, they've removed fibroids before. It can actually grow back, but it's not very common. But it can go back. Okay. Now, I've covered a lot regarding fertility. I know that we don't have a live audience like now, so there might not be opportunity for questions. But I'll try and bring simple questions that people ask, usually on our ATG page. Am I allowed to proceed?
Yes, you can.
So the first concern people have is that, doctor, I'm having sex and the sperm seems to be pouring out. Is that the cause of my infertility? In our Yoruba people in Africa, they call it Eda or something like that. It's not a cause of infertility. If anybody in the world has sex with their wife and their wife gets up on the bed, sperm will pour down. If you like, you can hang your leg on the roof, and once you're about to walk, the sperm will come down. It's the law of God, the law of gravity. It's the law of the world. It's the law of God. It's the law of gravity. Okay, it's normal. And if you go and pee after sex, or if you go and pee tomorrow after sex, you have sex today, you pee tomorrow, sperm will still wash down from vagina. It's normal. It's not anything to worry about. The most important thing is that it's a sperm of good quality. If it's sperm of good quality, it will swim and enter the womb without delay. So, yeah, so getting up after sex or seeing sperm pour down in the woman vagina does not mean sperm is pouring out. Most cases, those are the bad sperm that cannot even do any job anyway. As far as the sperm is good quantity, they are good quality among them, they will swim into the womb. And they will get to the womb and they'll sit down there like snipers, waiting for the eggs to come, and they catch the egg and they get pregnant. Some sperm, they can live in the vagina and they can live in the womb cavity for up to 5 days. Some sperm, they are notorious. They can hang and they can wait. Just like some boys too, they want to toast a girl. They can sit down from morning to night on the highway looking for that girl, and they will wait for that girl to come out of their father's gate to toast the girl. Some sperm too, they will stay. They'll be hungry. They will still stay there. They will not go. They are audacious. They will not go anywhere. So there are some sperm like that. So if you get after sex, it's not going to cause this thing. Number 2, if you have an infection, any kind of infection, always remember that the vagina is like an open wound. The vagina has a direct connection from your outside into your womb cavity, and your womb is open into your tubes to your tummy. So you, as a woman, you must treat your vagina as an open wound. That is when I get upset whenever I hear women that they are putting all this rubbish thing they put in their vagina. Some people don't even respect their vagina. They can put Maggi, they can put salt, they can put something they call karamata or something in their vagina, as if their vagina is a cookery pot. Some people even put some hot stupid things in their vagina, as if their vagina is a cookery pot. And I get like, these people, okay, people, see, vagina must be treated as an open wound. If you have an infection, treat it on time. Infections not treated appropriately, not treated on time, or repeated infection increases the risk of damage to the tubes. And once the tubes are blocked, it's very difficult to unblock them. Some people, yes, they do hydrotubation to see if they can unblock tubes. Hydrotubation is basically you're trying to force fluid, very hot fluid under high pressure to unblock the tubes, like going into the vagina womb cavity and unblocking the tubes to see if it can happen. It works only 1 out of every 4 patients, and it's not reliable. Once the tubes are blocked, they are gone. It's the honest truth. Once the engine don't bafuka, you can't ring the engine. You have to buy a new engine. That is the tube. So women should protect their tubes and guide their vagina with all respect. I can't say that enough. Yeah. Another thing that women worry about is that women, they always chat with their friends. Somebody got pregnant, they're using Clomid. Somebody got pregnant, they're using letrozole. You want to go and start gulping it down as if you are swallowing candy. Don't. You don't know their story. In fact, some women that are on Clomid, they don't even know why their doctor put them on Clomid anyway. But they go and tell their friend that, hey, well, Clomid, I use Clomid, though. Use Clomid too, you can get pregnant. But yeah, you use Clomid, but why did you use the Clomid? That friend will not tell you the full reason why she used Clomid, because she want to tell you all her full life history. Or some will not even know anyway. And you two go and start swallowing Clomid and damaging your ovaries. If I saw a woman that took Clomid, even under prescription, she was from Somalia, and I saw her in that time in Liverpool area. That woman was as if she had cancer. She was almost dying. In fact, she was put on dialysis because her kidneys were knocked down. Those medications we give people, they are very, very potent. They are powerful. In fact, in medical school, every medication should be treated as a poison. Poison, yes. That is to say, be careful. You must have a good reason to give anybody any medication. And if you do give them medication, you must be able to follow them up. So if you need Clomid, fine. Somebody must watch over you and do follicular tracking. Don't go and start swallowing Clomid like candy or like Panadol. Clomid is a very potent medication, and it can knock and it can destroy ovaries. And if you put on Clomid anyway, you should have follicular tracking from day 9 of your cycle, day 9, day 11, like that, to see if your body is responding to the Clomid. And if it's not responding, we can consider increasing the dose of the Clomid in your next cycle. By the time you're using Clomid for 4 cycles, you're not getting pregnant, that means that probably Clomid is not for you. You are now tilting towards IVF territory. IVF is not a sin. IVF is, I know some religious groups, they won't like IVF. I won't mention any, but some people will not even believe in it. Some people, they'll believe in IVF, but it's time to do IVF. Maybe their sperm is not good, they need sperm donor, or the egg is not good, they need the egg donor. Then they start become, or they become no, I can't. Well, people do have blood transfusion. I agree that sperm is genetic material. It's a different thing entirely. But at the end of the day, I tell people all the time that if you need egg donor or sperm donor, it's not nothing wrong. You see, we are born by love or by nature. My father and mother, they are not related, but they have me. I'm related to them. What bond them together is love. They are one family. I'm also in their family too, and they gave birth to me by genes. So we are related to each other by love or by genes. Because somebody is not your genetic relation does not mean that you can't love them and be one family. So if you need egg donor, there's nothing wrong. And some people will say, maybe the person come and say is their child in future. It depends on where you got the egg donor. That's why I tell people, don't collect egg donor or sperm donor from family or friends. Use commercial donor and move on. I've seen many people, they've not been able to get pregnant. They've come to me at Ivf Center. We have an IVF facility at Ask Gynaecologist. And today, their mothers and children, they have their young children, they've moved on. Nobody wants to know how you got there. You get there anyway, and the past is gone. No matter how many times you fail and you sit an exam, the day you pass that exam, nobody will ask question. How many times did you fail the exam? It's up to you. You see, the end justifies the means. As far as you've not done it illegally, you've done it with faith and with fear of God, and you've not hurt anyone. God can answer our prayers in many, many ways. I can tell you that for sure. And that is the world we live in. Let me rest a bit. Let me let you talk, then I'll continue. Let me rest a bit.
Okay, thank you very much. You've touched on a lot of things. You've touched on the causes, you've touched on treatment options, you've touched on misconceptions that people have. I don't know, I don't have any questions again, really. But okay, I wanted to touch on just one last thing. Yes, your ACG app, the ACG Foundation. I wanted to just give an audience just a short summary of what that's all about and how they can reach the foundation or the society in case they want to.
Yeah, thank you so much, Mr. Shitu. ATG, I started on November 15. It was during a difficult it was really a difficult life crisis for me. And I was finding a way to evolve and to start a new life, basically. Sometimes you get born again. Born again is inward. It's not until someone tells you you're born again because you want a new life, you want a new leaf and a new turn. I'm not talking about the church or the something about a church or whatever born again people talk about. To me, that's not born again. That they don't know what. Let me leave that one. Born again is by discovering yourself, know your connection to God, and when you discover yourself, you discover God in your own way, and you call God the name that you know. When people call God different names in the Bible or in the Quran, with all due respect, those names they call God is what people discover God to be. My healer, my conqueror, my this and that. Because God, so until you discover God yourself, you don't really know God. Until you now call God the name that you knew him at your times, that is when you know God. That's when you are truly born again. Your soul communicates with God. Nobody tells you, you know you are hearing God and you know that you are convinced that God is leading you. And when God is leading us, okay, the first thing that comes is joy. You feel that joy that you are doing the right thing. You have happiness. You're doing something, you're not happy about it, there's no God there. That is the easiest thing that God tells that I'm here. No happiness about it, God is not there. So during that life situation, I said that how can I reach out to people? How can I make myself valuable to people? So I'm like, I'm a doctor, gynecology. Let me start. So I started talking on Facebook about Ops and Gynae. I formed this Ask Gynecologist group. And so suddenly, then we were just doing question and answer, posting topics and all these sort of things. Suddenly, Facebook came up with this live talk, live thing on Facebook. So we jumped on it. And we started using that thing to reach out people, live talks, okay, answering questions. Then we evolved into doing seminars. Then people started to try to reach out to us At that time, for 1 year, I'll be answering questions every night after I go back from work on email. After a while, my fingers, my digits were aching me, and my eyes were aching me. I said, I can't continue this. So we started to form these premium services where people can subscribe, and I can talk with people maybe for a month or a year, whatever. So that evolved into that. Then with time, people wanted to get pregnant. Then infertility became our topic, almost 80%. Infertility, because that's what people want to hear. Next thing is about fibroid, about ovarian cyst, and that. So we now decided, okay, let us have a laboratory where people can do investigations and all that. So we opened a laboratory, and within a year of doing the laboratory, we opened an IVF center earlier this year because people needed IVF as well. So that's what we've been doing. To reach out to us is very easy. I can always consult with people at any time of the day as far as I'm awake. I'm always consulting. And we can go through the ATG premium services. Our email address, you can send us an email and we will reply to you as soon as we are awake. Or my secretary, Nike, will get back to you. Our email is atgservices, services 2018@gmail.com. Again, Alpha Tango Golf Sierra Echo Romeo Charlie India Victor Echo Sugar 2018@gmail.com. Or you can send me email to my personal email, admin@jidoba.com. Admin is Alpha Delta Mama India Nancy @jidoba. John India Delta Orange Bravo Alpha.com, and I'll reply you as soon as possible. And I'll give you guidance on how to register for the services, and we can take you all along from there. And I can also send you information about the subscription as well to you after this discussion, and you can put it on for people to see if they need to. I don't know how that will work. You decide.
Yeah, but I'll pass a link to the comment section.
Yeah.
So, okay.
And what I do is I go through your results. If you've done results, you can do your test at any reputable laboratory. Forward it to me on my WhatsApp number. I'll review them and I'll tell you the best thing to do and how to take the best action to get your result. And if you're in Lagos, you can come to my laboratory, get your test done there. And if you need IVF, ultimately, you can also do your IVF there as well. And I'm not in Nigeria all the time. Corona has not made it very favorable, but I'm planning to go at some point this year, and I can consult with people physically. But at the ATG Ivf Center, we have reputable IVF specialists there, and they consult for us consistently every day.
Okay, sir. And so one last question. I see that you mentioned IVF, in vitro fertilization. But some of our audience may not even know what IVF is. I know you know, but some of our audience may not know what it is. So we just quickly touch on it, so they know what this IVF is.
Yeah, IVF is a big thing. Basically, it's in vitro fertilization. In vitro, I is the in vitro, V is the vitro, F is fertilization technology. Anything that we do that we assist in collecting sperm, put it into the womb, or putting fertilized embryo in the womb is IVF. Basically, to assist and to complement conception. So what we do, IVF, we can, first of all, if somebody has difficulty getting pregnant, unexplained infertility, they've been trying for a long time, pregnancy is not happening, or maybe the tubes are blocked, we can't get eggs to transit the tubes to get into the womb, or maybe the person is not ovulating at all, or the sperm is not good at all, we have to do IVF. And there are a lot of things we put into consideration before doing IVF. You know, the choice of the eggs. If you're not ovulating at all, we want to get the best egg for you. We want to choose a very fertile donor, and so on and so forth. So basically, sometimes what we do, the basic IVF is we're using your own egg, we're using your own sperm, your own husband's sperm. We stimulate the ovaries at some time in your cycle. We now bring you for egg retrieval. We retrieve the eggs. We tell your husband to produce sperm for us, through masturbation or whatever in the laboratory. We put the egg, sperm, fertilize, put them in the incubator, and let them work together for about 4 or 5 days, usually about 6 days. We take them out, then we implant it back into you. 2 weeks after that, we do test of pregnancy, you're pregnant. Simple as that, but expensive. The medications for IVF are expensive. There's nowhere IVF is cheap in the world, but Nigeria seems to be one of the cheapest places in the world to get IVF done. In the UK, it's about 8K northwards. Nigeria is about 8K in Naira is about 4 to 6 million Naira. In Nigeria, IVF is about 1 million to 1.5. It's relatively, I think it's expensive, but it's relatively cheap in Nigeria. In America, people collect loans, almost 30 grand for one IVF. People have been indebted from IVF. And the good thing about IVF as well is that we can also do other things, where we can know if this embryo is carrying some sort of genes that we don't want. So if, for example, you are AS, your fiancé husband is AS, when you want to know that the egg is SS or not before you implant it, we can do tests to know if the egg is SS before implantation. We can even know the baby's gender before we transfer. We can check for some genetic abnormalities that are probably familial or hereditary before we transfer to know if they are there or not. And that's basically IVF. Yeah, and we can also do egg donor, sperm donor. We can also freeze your eggs in case the IVF fails. We can use the frozen embryo to get you pregnant again, and so on and so forth. And if you are using your own egg, your own husband's sperm, IVF is about 1.1 million naira at the ATG IVF Center. So so we are trying our best to bring the cost down. The naira is not favorable; it's always getting depreciated, and it's going to happen for as long as we live, I think. So we just try to keep our costs constant, despite the naira's inability to be stable.
Okay, so thank you very much, sir. This has been a very enlightening session. To the viewers, I hope you've been able to gain as much or more than I have. Thank you very much, Dr. Obadile, for raising our invite.
You're welcome.
Yes, sir. So, guys, all of you out there watching, remember, if you have questions, you can just ask them in the comment section, and I'll be sure to convey them to Dr. Obadile. And it will also be attaching the link to his services and his office, his website. I'm going to be attaching the link in the comment section so you can find everything you need there. So I see you again next time. And thank you for watching our Healthcare Health and Lifestyle interview. Have a wonderful day.
Thank you. All right. Thank you very much.
Yes, sir.
Yeah.
Yes, sir. So I think we're done with that. Well, okay. That was a great session, sir. That was a nice one.
Thank you very much.